Ever find yourself scrolling, thinking this purchase will finally make you happy? And then, well, a week later, you're kind of back where you started, maybe just with more stuff.
Yeah, it's like chasing something you can't quite catch. That feeling of enough.
Exactly. So let's try to unpack some of that. Welcome to the Deep Dive. Today, we're jumping into a whole mix of recent news and research, all pulled together for you by Consumers.App. It's May 18th, 2025.
And we've got quite a range today. Everything from workout supplements to food packaging, even some ancient wisdom making a comeback.
Yeah, some surprising links between things. Let's start with those supplements, especially the ones aimed at young athletes. There was a report recently highlighted something about this market being, well, saturated.
Right. Products promising big results, creatine, caffeine, protein powders, you name it, all marketed for muscle growth, better performance.
So Consumers Research asked, what are the most common ones kids are using and what are they supposed to do?
Well, it's a whole list. Protein, creatine are common. Then you get into things like BCAAs, pre-workouts, all sold with this idea of giving you an edge. And young people see this marketing constantly. It really shapes how they think about success in sports.
But is it all safe? That's the big question, isn't it? Especially with things like DHEA or prasterone. The report mentioned potential health risks.
Yeah, DHEA is interesting. It's over-the-counter here in the U.S., but banned in some other places. That difference alone makes you pause. Right?
It does. What are the specific risks they found for young people?
Consumers Research looked into that. Concerns include things like masculinization in girls, headaches, sleep problems, basically messing with hormones. And the fact that it's easily available here while being flagged elsewhere, well, it shows you need to look beyond just whether you can buy it.
It really makes you think about how these things are regulated, or maybe how they aren't.
Exactly. In the U.S., dietary supplements fall under DSHEA, the Dietary Supplement Health and Education Act.
Yeah.
And that means they don't get the same safety checks before they hit the market as, say, prescription drugs do.
So the system is less strict.
Definitely. And Consumers Research notes this has direct implications for young consumer safety. It increases the risk of, well, contamination or hidden ingredients.
Contamination? You mean like other stuff accidentally getting in?
Sometimes accidental, sometimes not. There have been cases, serious ones, where supplements were found to contain banned substances, even actual pharmaceutical drugs that weren't listed on the label.
Wow, that's a huge risk, especially for an athlete who gets tested.
Absolutely. The potential for serious consequences is significant. Regulatory bodies have put out warnings. Research keeps finding these issues. It's a real problem.
So what do the health authorities like the pediatric groups or the FDA actually say about this? What's their advice?
Their guidance is pretty consistent. Focus on a balanced diet. Real food first. That's the priority. Consumers Research confirmed this. They generally discourage performance-enhancing supplements for kids and teens. There's just not enough solid proof they work well for young people, and there are potential risks. Always talk to a doctor or a registered dietitian before considering any supplement.
Okay, and what about the science itself? What does recent research say about whether these supplements actually boost performance in youth?
Well, according to scholarly research from the last 5 years or so, analyzed by Consumers Research, the evidence is pretty limited. For most supplements, there isn't strong proof they make a big difference in young athletes. The real gains, they mostly come from good training, proper nutrition from food, and enough rest. There's often a big gap between the marketing hype and the scientific reality.
That's really important to know. So for parents, for coaches, what can they actually do to help kids navigate this?
Communication is key. Talk openly, honestly. Provide evidence-based info, not just marketing claims. Really encourage that focus on whole foods, on good nutrition habits. And like we said, always push for consultation with a healthcare professional before any supplement use. That's how you reduce the risk.
Okay, let's pivot a bit. Multivitamins. So many people take them daily, but do we actually need them? There was a piece looking into this.
Right. And the consensus from regulatory bodies and a lot of recent research, generally no. For most healthy people, daily multivitamins aren't really necessary. They don't seem to prevent major diseases either.
That probably surprises a lot of listeners who pop one every morning.
It might. It's become such a habit for many, sort of like health insurance in a pill.
Are there exceptions, though? People who should take them?
Yes, definitely. People with diagnosed nutrient deficiencies, for one. Pregnant women or those trying to conceive need folic acid. Sometimes older adults or people with specific medical conditions that affect nutrient absorption might benefit. but it should really be based on specific needs and often medical advice.
What about those biomarker studies? Can't blood tests tell us if we need a multivitamin?
Biomarkers can give a more objective picture of your nutrient levels, that's true. A 2022 study showed that. It's better than just trying to remember what you ate. But the link between taking a multivitamin and actually seeing better health outcomes in the general population, that's still pretty mixed. So a biomarker might show low vitamin D, for example, but whether a generic multivitamin is the best fix for everyone, that's less clear.
Okay. And are there any downsides? Can taking a daily multivitamin be harmful?
Yes, there can be risks, especially if you take too much. Some vitamins and minerals have upper intake limits. Think vitamin A, vitamin D, iron. Exceeding those consistently isn't good. It highlights why just taking more isn't always better and why checking with a doctor is smart.
The report also mentioned something about economic factors influencing multivitamin use.
Yeah, that was interesting. A 2023 study found that economic hardship, like from the pandemic, actually made nutritional health gaps worse, especially for women. In situations where getting a varied, nutritious diet is tough financially, people might turn to multivitamins as a sort of compensatory measure, a cheaper way to try and fill those gaps. It shows how bigger societal issues play into these choices.
So just to sum that up, who are the main groups likely to benefit?
According to medical and regulatory guidance, it's mostly people with poor diets, older adults, pregnant or breastfeeding women, and those with specific medical issues impacting nutrition. It's really about targeted use, not a blanket recommendation.
And it also mentioned there's no standard definition for a multivitamin. How does that affect things?
Right, that lack of a single global scientific definition means formulations can vary a lot. What's in one bottle might be quite different from another, even from the same brand sometimes. In the U.S., it generally means at least 3 vitamins and minerals. But beyond that, it's not strictly standardized worldwide. So as a consumer, it puts more responsibility on you to, choose reputable brands and really read the labels carefully.
And back to the biomarkers for a second. How useful are they really in judging if a multivitamin is working for you?
They can be helpful, yeah, for tracking changes in nutrient status if you start taking something. But not every nutrient has a reliable biomarker test. Plus, our bodies all absorb and use nutrients differently. So while they add objectivity, they don't replace looking at your overall diet and health picture with a professional.
Okay, let's shift focus again. Hypertension, high blood pressure, particularly in India. There was a report linking it strongly to diet, especially salt.
Yes, high salt intake, especially common in urban diets there with more processed foods and eating out, is a big driver of rising hypertension rates, even among younger adults.
How does the salt actually cause the high blood pressure?
Well, basically when you eat too much salt, your body holds on to extra water to dilute it. That extra water increases the volume of blood flowing through your blood vessels, which in turn increases the pressure inside them. And this isn't just an issue in India. It's relevant for anyone eating a lot of processed or restaurant food.
It's not just salt, though, is it? The whole dietary pattern matters.
Absolutely. A 2024 study specifically linked poor diet quality, low fruits and veggies, high salt to hypertension risk, particularly in low-income women. It really shows the power of our overall food choices.
And technology might offer some help here. The report mentioned apps.
It did. Mobile health apps using AI for food recognition are emerging. The idea is they can help you track your salt and nutrient intake more easily, give you feedback, maybe nudge you towards healthier habits, a potential tool in the toolkit.
The DAS diet also came up. What is that exactly?
D- stands for Dietary Approaches to Stop Hypertension. It's a specific eating plan, lots of fruits, vegetables, whole grains, lean protein, low-fat dairy. And crucially, it's low in sodium, saturated fat, and cholesterol. It's well-researched and proven effective for lowering blood pressure.
What's the official salt recommendation in India?
The FSSAI, their food safety authority, recommends less than 5 grams of salt per day for adults. That's in line with WHO guidelines. It really emphasizes the need for awareness about hidden salt in foods.
This hypertension issue also seems to point to bigger public health challenges there.
It really does. India is facing this complex situation, what they call a dual burden, still dealing with undernutrition in some populations, while also seeing a rapid rise in non-communicable diseases like hypertension and diabetes, often linked to urbanization and changing lifestyles. It's a global pattern, really.
And the long-term consequences if young people ignore high salt intake or nutritional gaps?
They're serious. Ignoring it can lead to hypertension starting much earlier in life, and that significantly bumps up the risk for heart attacks, strokes, kidney disease, and other major health problems down the road. Early intervention is key.
Okay, let's talk about something we might not think about as much. Chemicals in food packaging leaching into our food.
Yeah, this is getting more attention. Things like phthalates, BPA, PFAS, these are synthetic chemicals common in plastics and packaging. They can actually migrate from the packaging into the food itself.
How does that happen?
It's more likely when the food is fatty or if the package is heated, like microwaving in plastic. The chemicals can sort of move into the food.
And what are the health concerns associated with these chemicals?
They've been linked to potential issues like hormone disruption, developmental problems, maybe increased risk for some chronic diseases. Now, regulators set safety limits, but there's ongoing debate about the effects of long-term low-dose exposure, especially since we encounter so many packaged, often ultra-processed foods.
Is anything being done to create safer packaging?
Yes, definitely. There's a lot of research into alternatives. Things like biodegradable packaging, materials made from plants like starch. Some are even incorporating nanoparticles like zinc oxide to add antimicrobial properties, making them active packaging.
There was mention of a food packaging forum. What do they do?
They're a nonprofit foundation. They focus on gathering and communicating the science around food packaging, chemicals, and health. They try to provide independent information for everyone involved: consumers, scientists, industry, regulators, and advocate for safer options.
How do these newer bio-based packaging types compare to the plastics we're used to?
Well, a study back in 2019 looked at starch-based films with zinc oxide. It found they were pretty effective at stopping microbes, sometimes better than synthetics, and they were also biodegradable. So potential benefits for both safety and the environment.
And AI is popping up here too, in the supply chain.
It seems AI is everywhere. Yeah, it's being used to help monitor food safety throughout the supply chain. Things like predicting contamination risks, helping optimize quality control, even automating checks on expiry dates for packaged goods.
What makes regulating these packaging chemicals so difficult?
It's complex. First, there are just so many different chemicals used. Second, understanding the cumulative effect of being exposed to tiny amounts of many different ones over years is really hard. And third, global supply chains mean food and packaging cross borders constantly, making consistent regulation tricky. The push is towards using inherently safer materials from the start, more transparency about what's in the packaging, and trying to get more comprehensive, ideally global, regulations.
Okay, let's shift to our wallets now. Lifestyle inflation. That sounds potentially painful.
It can be. Lifestyle inflation, or lifestyle creep, is basically when your spending increases just because your income does. Luxuries slowly turn into perceived necessities.
I got a raise, time for a nicer, car bigger apartment effect. How does it actually stop you from building wealth?
Because those increased recurring expenses, the bigger car payment, the higher rent, more subscriptions, eating out more, eat up the extra money. So even though you earn more, less of it, or maybe none of it, goes towards saving or investing. Your net worth might not grow much despite the higher paycheck.
What can people actually do to fight this creep?
Budgeting is fundamental, knowing where your money goes. Automating savings is huge. Set up automatic transfers to savings or investment accounts right when you get paid. Also, regularly review your financial goals. Consciously ask yourself, is this a need or a want? Practicing mindful spending helps break that automatic upgrade cycle.
Is this a common problem? Did the article mention any stats?
Yes. Recent surveys suggest it's very common. A significant chunk of working professionals say their spending goes up pretty quickly after getting a raise. Often, discretionary spending increases almost immediately, while saving rates don't keep pace.
And get this, AI might even be playing a role in inflation itself, like in housing.
It's a newer area of research, but yes. The idea is that widely available AI-generated price estimates, say for real estate, can influence what sellers expect to get and what buyers expect to pay. This can potentially create a feedback loop that pushes prices up, contributing to inflation in that sector.
And even just hearing about inflation in the news affects us.
Apparently so. Research shows that media exposure to inflation news shapes our expectations and can influence our financial behavior. If we constantly hear prices are rising, we might spend more now to beat future increases, or maybe become overly cautious. It impacts decisions.
There is also an interesting link drawn between personalized diet advice and financial well-being. How do those connect?
Well, if personalized nutrition recommendations, perhaps using AI or knowledge graphs, help people eat healthier and prevent diet-related diseases like diabetes or heart disease, that can save a lot of money on healthcare costs down the line. So healthier lifestyle choices leading to better financial health.
Okay, let's move to fasting. An article looked at Buddhist monastic fasting and how it relates to modern health trends.
Right. Buddhist fasting isn't about extreme deprivation. Key principles are mindful eating, usually stopping eating after midday, moderation, and following the middle way, avoiding extremes. It's about balance for both body and mind.
How does that connect to intermittent fasting, which is so popular now?
The core idea of restricting eating to a certain time window is very similar. The Buddhist practice of not eating after noon is essentially a form of time-restricted eating, which is a common type of intermittent fasting studied today. And research is showing potential benefits for metabolic health and maybe even longevity from intermittent fasting.
What kind of benefits are scientists seeing?
Studies suggest intermittent fasting can trigger a metabolic switch. Your body starts burning fat for fuel instead of relying solely on glucose. This shift seems linked to improvements in things like cardiovascular health, blood sugar control, maybe even brain health, and reducing risks of age-related diseases.
But should everyone just jump into fasting? Are there cautions?
Definitely cautions. Experts stress that it's not a one-size-fits-all approach. Things like your genetics, your overall health, your lifestyle, they all matter. Applying findings from studies broadly needs care. Personalized advice based on evidence is really important to get benefit safely.
Moderation seems key in the Buddhist approach. Why is that so important?
That middle way idea, moderation, is crucial for making it sustainable and healthy long-term. Eating mindfully, stopping when you're satisfied, not overindulging it, prevents the cycles of restriction and overeating you see with some extreme diets. It builds a healthier relationship with food.
What about human lifespan? Does research on how long we can live give any context here?
Well, some demographic models, like the Wheelon model mentioned, estimate a potential maximum human lifespan somewhere around 120, maybe 130 years. While practices like fasting might help us live healthier for longer, increasing our health span, there might still be fundamental biological limits on overall lifespan.
So is there evidence that this kind of moderate time-restricted eating is actually effective for weight management?
Yes. Studies on time-restricted eating, which mirrors the Buddhist approach, generally show it can be a safe and effective way to lose weight for many. By naturally reducing the eating window, people often consume fewer calories overall without feeling overly restricted. And it can also improve insulin sensitivity.
All right, let's shift to aging itself. How we think about getting older seems to be changing based on a recent piece.
Yeah, there's some really encouraging news. Trends show dementia rates are actually declining among Americans in their 80s and 90s.
Really? Why is that happening?
It seems to be linked to several things. Better overall health care, much better management of cardiovascular risks like high blood pressure and cholesterol over people's lifetimes, and also higher levels of education seem to play a role.
That's fantastic news. And older adults are also recovering better after serious illnesses?
They are. Advances in ICU care are part of it, but also a bigger focus on early rehabilitation, getting people moving sooner and better programs to transition patients from hospital back home or to other care settings. It's a more holistic approach to recovery.
So what are the key things helping seniors, thrive more in later life, both physically and mentally?
It's a mix. Staying physically active is huge. Keeping socially and cognitively engaged, learning, interacting, managing chronic conditions effectively, having good access to healthcare and good nutrition, and strong community support makes a big difference too.
How does the U.S. healthcare system support seniors generally?
Primarily through Medicare, which is the federal health insurance for 65 plus Melly 2, and Medicaid, which helps those with lower incomes. These are crucial safety nets, though. Challenges and disparities in access and quality of care definitely still exist.
The article also stressed the importance of social factors, right?
Absolutely. Research increasingly shows how much things like social isolation or socioeconomic disadvantage impact health outcomes in older age. Addressing loneliness and financial hardship is becoming recognized as vital for healthy aging.
Are there new technologies being developed to help with cognitive health in seniors?
Yes, some really cutting-edge stuff. Things like tensor machine learning to analyze complex brain data for early signs of cognitive decline, and even brain-computer interfaces are being explored as potential ways to support cognitive function down the line.
And looking at death rates regionally helps target support.
Exactly. Analyzing age-adjusted mortality trends across different parts of the country helps public health officials see where the biggest challenges are for older adults and allows them to tailor strategies and resources more effectively.
Okay, one final topic. AI in agriculture. Farming is getting smarter.
It really is. AI is making a big impact through things like precision irrigation. Systems analyze weather data, soil moisture, plant needs, and tell farmers exactly how much water to use and where. Same idea for fertilizers.
Yeah.
Optimizing resource use, increasing yields.
What are some other recent AI innovations in farming, and how do they help farmers financially?
We're seeing AI-powered drones monitoring crop health from the air, robots that can identify and remove weeds or target pests precisely, machine learning models predicting disease outbreaks before they spread widely. All of this helps farmers cut costs less water, less fertilizer, less pesticide, maybe less manual labor, and boost their profits through better yields and quality.
But it can't be all smooth sailing. What are the hurdles to adopting AI in farming?
There are definitely challenges. Reliable internet access and the right tech infrastructure aren't available everywhere, especially in rural areas. There's a need for people with the skills to use and maintain these systems. And then there are concerns about data, who owns it, privacy, plus regulatory questions.
Drones seem particularly important in this. How have they changed things recently?
Drones, or UAVs, have become really key for precision agriculture in the last, say, 5 years. They let farmers gather incredibly detailed real-time data about their fields, spotting problems early, managing water and nutrients much more accurately.
What's the bigger picture effect of all this on the global food supply and sustainability?
Well, by helping farmers grow more food with fewer resources, less water, less chemical input, AI-driven precision agriculture has the potential to make our food supply more resilient and reduce farming's environmental impact. That's crucial with a growing global population and climate change.
Are there ethical issues to consider as AI gets more involved in how our food is grown?
Yes, for sure. Things like, how do we ensure small farmers can access and benefit from this tech, not just big operations? How is farm data protected and used ethically? What happens to farm jobs? We need policies that address fairness, privacy, and inclusivity.
And does academic research confirm that these AI models actually work well in practice?
Yeah, studies using advanced crop simulation models, like one called Wolfow's Gym was mentioned, show that these AI tools can genuinely help farmers make better management decisions. They can process way more data and complexity than a person can, leading to optimized strategies for planting, watering, fertilizing, and harvesting.
Wow, okay. We've covered so much ground today, from supplements and vitamins to food packaging, lifestyle creep, fasting, aging well, and now smart farming, all thanks to the curation by Consumers.App.
It's fascinating how interconnected it all is, isn't it? Health, money, technology, food.
It really is. And a key takeaway seems to be the importance of critical thinking, looking beyond the hype, whether it's a supplement claim or a financial trend. Thank you so much for taking this deep dive with us today.
My pleasure. It highlights the need for good information.
Absolutely. So here's a final thought to leave you with. Given how fast AI is developing in so many of these areas, to talk about health, finance, agriculture, how might our everyday choices and routines look fundamentally different, maybe even just 5 years from now?
That's a big question to chew on.
It is. Thanks again for listening. For more details and to do your own deep dives, definitely check out Consumers.App. Until next time, take care.